Postpartum depression has been a subject of concern since a very long time, and it's time that we start addressing this issue more openly, talk about it more openly, and educate masses around this subject positively. So today's topic of our podcast's episode is postpartum depression, medication and therapy around it. And for this very important conversation, I have with me Dr. Aakash Ponda, who is currently working as a consultant psychiatrist at Ponda's Psychiatric Care in Vadodara. He finished his MBBS from Civil Hospital Valsad and also finished his MD in psychiatry from MGM Hospital in Mumbai. He has received prestigious Young Scholar Fellowship in 2003 at International Psychiatry Conference in Hyderabad. This is a very important podcast for all the men and women who are expecting to be parents very soon, and also their relatives and friends. I would request you to watch this episode with a lot of diligence and share it with all the people who you think might find it useful. And if you like the content of this podcast of this particular series, then please subscribe to Winged Fables YouTube channel. Enjoy this episode. Hi, Dr. Akash. Thank you for
Hello.
joining in for such an important conversation. I think this topic is very relevant. It was relevant earlier as well, and I think it is more relevant in today's time. And I'm very,
Definitely.
very
It's my
glad
pleasure.
to have you for this episode. Yeah.
Thank you.
So, Akash, I'll start by asking you that what before we jump on to the main conversation, to the main topic of postpartum depression, I would want to understand that what are the internal biological changes that happen in a woman's body throughout her lifestyle or throughout her lifetime that actually affect her mental health positively or negatively.
Right. So it starts since birth. So when a baby girl is just born, the maternal hormones are at its peak. And just after the birth, they decrease, right, to a very, very low levels. And then till puberty, those levels are maintained. So very low levels of estrogen, progesterone, which are the main hormones in a woman's body. Those are at a very, very minimum level. And at puberty, what happens is that they start increasing. So at puberty, there are a lot of changes which occur in a woman's body, and those changes also affect her physically as well as mentally.
Hmm.
And the mental aspects of it are mainly sometimes there are very mood fluctuations which are observable by the female. The other thing that happens very often is they become hypersensitive to emotions.
Okay.
So that is one thing that they start feeling, and they start getting affected by a lot of things.
Hmm.
So because of these hormonal changes which have happened first time in their lives, it is very new to them. It is very,
Okay.
very, because they have not been trained for it. What is happening to their body? What the changes, physical changes also that undergo
Yeah.
they undergo during puberty. So because of that, there are also very many a times body image issues which they
Hmm.
face. So when they look in the mirror, they see a person who is completely different. Right? They've not seen this version of her ever before. So that also affects a lot of times. After that, their menstrual cycle starts just after puberty. So that is a very cyclical change which happens in every woman's body. A monthly cycle, which is a regular cycle, right? 25 days, 30 days, depends on person to person. But during that time, there is a rise in estrogen, then the estrogen drops, and there is a rise in progesterone. Right. So because of these cyclical changes, the rise and fall of estrogen, progesterone, there are a lot of uh, emotional disturbances which a woman faces. Also, I would like to add that missing the periods, missing the menstrual cycle, having irregular cycles, or having menorrhagia, which is the quantity of uh, and the days of the menstrual cycle are increased, or uh, hypomenorrhea, or decreased days of cycle, or decreased menses. These are also affecting a woman mentally as well, because always a regular cycle is very important for a woman's body. So whenever there is a break in such, they feel very apprehensive. They feel very scared because they don't understand what is going on. So a lot of times, a gynaec consult may help at this time. After that, during pregnancy, there are a lot of hormonal changes in the body. Estrogen, progesterone. With that, HCG is a hormone which increases in the body. With that, another hormone known as prolactin also increases, right? And this is the first time in their lives when these two hormones have started increasing. So everything is controlled by the hypothalamus, which is present near our brain, which in turn handles all the hormonal changes in the body of the woman. So it goes step by step. The hypothalamus, then the pituitary gland, then the ovaries, right? So a lot of so there is a gonadotropin secreting hormone which increases, gets secreted by the hypothalamus. Then these cyclical changes happen in a woman's body, because of which during pregnancy also there are a lot of mood fluctuations, a lot of irritability which can't be explained by hormonal reasons, a lot of uh, changes in the uh, temperature of the body as well, right?
Okay.
Then the sleep cycle may be affected because of that. The rhythm of the day also changes because of that.
Mm.
So just after the delivery of the child, there are other changes that take place. So there's a rise in prolactin, which had been started secreting since pregnancy to support breastfeeding, right? And the other hormones start decreasing, right? So there's a major difference in the levels of hormones pre-pregnancy and post-pregnancy, postpartum, because of which a lot of times, as we'll discuss in
Yeah.
this session, a lot of times there are proper mood changes, the postpartum blues as well, postpartum depression. At times there is postpartum psychosis, which may be caused in many people. So these are the major changes which happen till postpartum period. After that, there is a perimenopausal period, which is also very tough time for a woman in her life. It is just the beginning of menopause, so the regular cycles start, changing. The periods come late; they come 2 monthly, 3 monthly, which, as I said, it affects a woman. They start feeling that change inside their body. A lot of hot flushes which happen. A lot of uh, loss of control of emotions which happens during this period. Uh, Also, in the menopausal period, which happens just after the premenopausal period, uh, there are physical changes in the body which start taking place. So a lot of cases of osteoporosis start,
Okay.
and because of which the bones start becoming brittle, and uh, they start feeling very tired, right?
Mm.
Which sometimes they feel it is very unexplainable. They start having multiple pains in their body. Knee pain start, back pain start, and all these are directly related to the hormonal changes which take place in
Okay.
that body. Right? And then as aging increases, all these hormones which we discussed, they come to a very, very low level, just like pre-pubertal level.
All right.
So this is the whole cycle that takes place in a woman's body. I
Uh,
know it is a very scientific explanation of this, but
yeah. Yeah.
as a woman, you would definitely relate with whatever I have said.
Okay.
And
And yeah, this
yeah,
cycle, what is the length of this cycle? So it starts from pre-puberty as soon as a woman is born, a girl child is born. And
right,
then what is the average age until which the fluctuations of these hormones continue?
right. So menopause average age is 51.
All right.
So till that time, these major changes,
Hmm.
monthly changes as well as cyclic changes happen in a woman's body.
Hmm. Okay, okay. So like you have probably experienced and have spoken to a lot of women who are struggling with these biological problems, but I'm sure you must also be knowing about the various impacts of different social, cultural, and maybe financial troubles that a woman undergo uh, or face through in her life. So, what do you think is the impact of these factors on the mental health?
Right. So a woman has to play a lot of roles in her lifetime. So it starts like being a sister to someone, a daughter to someone. It proceeds to become a wife of someone, a mother of someone, grandmother. A lot of roles have to be accomplished by a woman.
Yeah.
So definitely there are a lot of responsibilities which as a man I fail to understand a lot of times because I don't know how they handle so many responsibilities. So a lot of times when women come to my OPD and I ask them, what do you do? Like,
Mhm.
uh, just a regular question, just to take the history and develop some rapport. They say, "कुछ नहीं करते. I don't do anything." Right? I'm like, no, you must be doing something. So they answer with uh, saying that I'm just a housewife.
Mm.
And like being a homemaker is a very big responsibility, right? You have to, have so many roles that you have to
Yeah.
fulfill in that day. You have to, take care of the whole house, children, if any, the husband, taking care of very small things like paying the bills, going to the office, cooking the meals, various responsibilities. So women themselves try to, negate all these roles and they say that I'm just a housewife, which is very surprising for me because I've seen my mother do so much for the family
Yeah.
and which I can't even, put it on paper, those many roles she has undertaken. So sometimes they don't even understand what they're doing for the family
Mm.
and they're not appreciated that much by the family members. So that is one thing that I've observed. This is a very daily occurrence in my life. Every day
Mhm.
this happens once or twice, and then I scold them. That,
Yeah.
you're doing so much for your family, and you just tell that I'm just a housewife. Doesn't make
Yeah.
sense to me, right? Uh, Financial responsibilities as well. In these days, you know, everyone is working and everyone has to work in this time,
Yeah.
and with that, the added responsibilities of these all these hormonal changes, which I just told you. Every month, during menses, some change occurs in their body,
Mm.
physically and mentally, and even beyond that, going to work
Mm.
in spite of the pain, going to work, working regularly and fulfilling their duties. Mm, I mean, I can't say more about it. I can't praise them more.
Yeah. So I think we'll come to the main subject of our discussion since we've built probably the
Right,
foundation of this topic. I would want you to explain how do you explain the word depression and how
right,
do you explain postpartum depression? Is there a difference
right.
between the two?
So depression is a mood disorder, right? In psychiatry, we always follow two diagnostic criteria. First is DSM-5, which is mainly based in the US. Psychiatrists in the US, they follow that system. In India, we do follow ICD, which is given by the WHO. So for diagnosis, we have criteria, proper set
Okay.
criteria for diagnosing any case of psychiatry. Depression is mainly a mood disorder in simple language. It is a mood disorder where there are changes in the mood of the person, which are very pervasive and sustained.
Mm.
So, the requirement for diagnosing a person with depression is there's a timeline as well. 2 weeks of pervasive, sustained, severe mood disturbances. So, mainly the features are sadness of mood.
Mm.
They don't have any pleasure in the activities that they did before. So,
Mm.
for example, if some person likes to go for a swim, for a walk, playing with their kids, or going to work, right? They don't have any pleasure of doing that at all during this period. With that, there are a lot of physical changes which occur.
Hmm.
So, the physical symptoms of depression mainly there are sleep changes.
Hmm.
They sometimes sleep very less or exceed the sleep time.
Hmm.
Sometimes there are also eating disparities where they don't have any appetite for anything. Or
Hmm.
in some cases, they eat excessively,
Hmm.
uh, especially carbohydrate loaded or rich food. Uh, a lot of, as I said, the sadness is very deep. There are a lot of negative thoughts. All the thoughts that they have are negative. The thinking becomes very black. So
Okay.
whatever thought they have was on the negative side.
Hmm.
I can't. They have these feelings of hopelessness, helplessness, and worthlessness. And also, in severe cases, there are a lot of suicidal ideations and suicidal tendencies will also take place in such depressed people. In psychiatry, I would like to add that there's always a spectrum of symptoms, right?
Okay.
So, a person of depression may also have a lot of features of anxiety as well. Right? Uh, Anxiety, as in restlessness, they may have physical symptoms of anxiety like palpitations, sweating,
Okay.
dryness of mouth. They sometimes may have panic episodes where
Hmm.
they feel that they may die.
Okay.
They don't understand what is going on, and a lot of physical symptoms of anxiety, which are very severe. They feel that something is going to happen to them. Right? They have fear of dying at that time. So all these sometimes there are a lot of obsessive complaints where one thought keeps on going on in their brain,
Hmm.
and most of the times it is a negative thought. In severe depressed cases, there are also delusions which happen
Okay.
where there's a thought stuck in their mind that something bad will happen to me, someone will kill me, right? So in severe cases, that also happens at times. So there's a lot of a spectrum of symptoms which happen, and in depression, every person has a unique symptom.
All
Every
right.
thought is unique, every person is unique. So the way of thinking that develops during this period of depression is very uncharted and unpredictable. So we can't say for sure what that person will do next.
All right.
Sometimes sudden bouts of anger also may happen, irritability. So it is a very severe thing.
Hmm.
And postpartum depression, as we're going to discuss now. Uh, Postpartum depression is a type of depression, but there are specific criteria for it to be diagnosed as postpartum depression. So it may happen few weeks or few months after you know uh, the delivery of a child, right? Uh, Postpartum depression has features of depression as well as some added features where there are thoughts, uh, some thoughts like I can't take care of my child effectively. I
Hmm.
won't be able to do this. There's loss of self confidence as a mother, as a person.
Hmm.
Um, a lot of times, hampered sleep just after a baby is born.
Hmm.
That also may trigger postpartum depression. Right?
Okay.
Also, the criteria of 2 weeks has to be followed in diagnosing postpartum depression. But sometimes thoughts of harming themselves as well as the child or as well as the partner may
Oh.
come in their mind, which becomes a very serious issue.
Okay.
So during that time, acute management of these thoughts and just are a must because
Hmm.
it may have a very massive consequences.
Hmm. So,
Right.
how can a woman herself understand that she is probably undergoing uh, these issues and these mental problems, and it is basically due to the biological changes that are happening in her body? But how can she herself, first of all, try and understand and try to curb these uh, these symptoms or these problems herself?
Right. So when the features of uh, so mainly the main features of depression, which are sadness of mood, anhedonia, which is the loss of pleasure, decreased interest in activities of daily life, decreased interest in taking care of the child, playing with the child, or taking
Hmm.
care of the child.
Hmm.
Uh, decreased wish to even breastfeed sometimes in
Okay.
acute cases, right? Severe cases. So these are the features that the woman herself has to be mindful about, as well as the family members have to
Hmm.
be mindful about.
Hmm.
If even though someone else is taking care of the baby, if the husband is taking care of, or a family member is taking care of the baby, still the woman is not able to sleep properly, or
Hmm.
it is a very happy time as well, birth of a child.
Yeah.
But if she herself feels that uh, you know I'm not, I won't be able to fulfill my duties as a mother,
Hmm.
right?
Hmm.
uh, there's a very very acute loss of self confidence. She feels
Hmm.
that I won't be able to do anything in the future.
Yeah.
I won't be able to feed my child. I won't be able to play with my child. I won't be able to take care of her child.
Hmm. Hmm.
These
Hmm.
are some symptoms she needs to be mindful about, as well as the family members.
Hmm.
uh, what they themselves can do during this difficult time,
Yeah.
during postpartum depression. um, Asking for help is very very important. In India,
Hmm.
where I reside, it is a very common accepted thing to go to their uh, family, as in
Yeah.
their mother, and uh, for that period, so that the child is taken care of very easily
Hmm.
and very naturally. She's in a comfortable space,
Hmm.
right? She's in a known space where she has grown up,
Hmm.
and everyone is invited turn by turn to take care of the baby as
Hmm.
well. So
Hmm.
asking for help freely is
Hmm.
one thing that she can do. Communicating her needs very effectively is also one thing, because a lot of times a lot of things are unsaid,
Hmm.
right? uh, she'll just keep it to herself, so that the person in front of her, her husband or her husband's parents, are they are not affected by her thoughts or emotions.
Hmm.
So
Hmm.
she'll keep a lot of things to herself.
Hmm.
So having a clear communication of her needs is also very important. Self-care is very important. So you know basic things like uh, uh, going for a bath in the morning, that also is missed by a lot of mothers
Yeah.
during this period, because they feel that if I can't take care of my baby, I can't take care of myself as well.
Hmm.
So they don't brush their teeth for days, they don't go for baths. So taking care of these small things as well are very important. Taking timely naps, a good sleep will also mitigate a lot of symptoms.
Hmm.
Whenever the baby is sleeping, you can also try to take a nap, right? And handing the responsibility of the baby to someone else and taking a nap, timely nap, is also very important. Also, nutrition and hydration are something which are ignored a lot of times in this period.
Hmm.
Uh, they sometimes, because of the features of depression, there's a very acute loss of appetite, and they don't feel like eating anything because of the hormonal changes. They do not feel like eating particular things, right? But whatever they wish to eat, if it is healthy enough, they need to eat it. They need to have a healthy appetite and a
Hmm.
healthy meal every day. And hydration is one thing which is ignored a lot of times. They just forget to drink water.
Yeah.
And to sustain breastfeeding, also, you need to have good nutrition and hydration.
All right.
These are
Yeah.
some things that she can try herself.
Hmm.
And if everything fails, definitely she can consult a mental health professional
Right.
to understand these problems a little better and find a solution to all these problems.
Yeah. Yeah. Um, one of the reasons, or one of the, if I can say, only reasons of recording this podcast on the subject of mental health is to create awareness about these topics. And I think it is very much important that we create a lot of support groups, because sometimes it becomes very difficult for an individual who is undergoing a problem to identify it herself or himself. So if the support groups, the families, friends, relatives, a neighbor, or any stranger is there
Definitely.
who, yeah, if he or she can understand a person and be available for him or her, it would be um, probably it's just an empathetic, creating an empathetic view towards the person who's undergoing some mental health issues. So with this regards, you I think you slightly touched upon the subject of asking for help, but then it is also very important for the people or the support groups, the friends, families, um, relatives to understand that this person requires help, especially in the case of postpartum depression or anxiety when a woman is undergoing. Because unfortunately, still in our culture, women have got, or mothers especially, are seen as people who should be able to do everything. And
Right.
yeah, and then a lot of tags probably come along if at all there is some lapse somewhere. And this is not a problem of the people, but it's culturally the way we've been brought up and lack of education. So what do you think is basically the role of friends, families, and how can they be supportive even if the person is not able to communicate or ask for help?
Right. Uh, if I could give a newer perspective of, my perspective to this
Yeah.
issue, a lot of patients who come to me, when I talk to their family members, they haven't been educated about all this. First,
Hmm.
they have not the slightest idea of what uh, the mother is facing or what changes happen in her body.
Yeah.
They feel that it has been going on since ages, so it is a very normal thing
Yeah.
that happens. So they don't have a slight understanding of the issue.
Yeah.
They don't understand it very well. So yeah, definitely, it is a very difficult task to educate them about all these things. But change is happening, and I'm very positive about the future that
Yeah.
change will happen, and
Yeah.
they'll understand these things better. But mothers who they need to educate their child as well about these issues. Talking about menses and periods, uh, why not? Why can't we have a very clear communication regarding this? Why can't we ask questions regarding? Still in India, the pads are carried in black bags, right? It
Yeah.
is a taboo to carry them openly. If a man goes to buy pads for his wife or sister, eh, they are judged upon.
Yeah.
So all these issues are definitely there in India as well, and as well as around the world. And I feel that an open communication and education regarding these issues are very, very necessary. Coming back to the question, the roles of family, friends, and relatives. Um, Empathy, as you said, empathy is mainly, if I can define it very simplistically, it is trying to wear the other person's shoes, like being in their shoes, right?
Mm.
Being in their position, which as I said, that is very difficult for them to understand. But what if I was there in their place, and what if I have never been trained for raising a child? This is my first experience.
Mm.
I've never been, my body has never been going through anything of this sort ever.
Mm.
So just being mindful about her emotions, the mother's emotions. If even if reading the body language and facial expressions, this is one thing that a lot of people miss. Uh, Sadness is always very evident in most of the faces, and happiness is also very evident. So if you have a newborn in your lap, so normally the expression is you're smiling and playing and playful, cheerful. If the mother's expression is none of that, if uh, it has a very tired look, she has no smile on her face, she's not cheerful at all, she's not playful at all. You see that sadness, deep sadness in her face, then you need to ask what has happened. Create a safe space uh, so that she can open up freely. Right? Sometimes confidentiality is one issue that a lot of mothers face,
Mm.
because of which going to a mental health professional is very easier
Mm.
because you get a safe space. There's
Mm.
an unknown person, but definitely a lot of people do not feel comfortable to share a lot of things on the first meet.
Yeah.
Uh, but husbands can, definitely try to be more confidential about whatever the wife is sharing about her emotions. Not share those with his parents, with her parents, right? That she was saying that day that she won't be able to take care of her baby in the future. That is something. even vocalizing that may be very difficult for the mother.
Hmm.
So just being mindful and creating a safe space is very, very important. And when you suspect something like that, also giving options, but not forcing her to take a decision at that
Hmm.
moment. What
Hmm.
happens is sometimes uh, give the child to your sister for a few days, you'll relax. Separating the child from a mother is also very difficult for her during
Yeah.
this time. Yeah, just give the child to your sister for a few days. That is something which definitely happens in the rural areas of
Yeah.
India.
Hmm.
A lot of times the babies only grow with the
Yeah.
Masi or
Yeah.
the
Yeah.
mother
Yeah.
sister. They grow old and they have no
Yeah.
special connect with
The
their own
mother
mothers.
herself. Yeah.
Yeah, mother herself. That is one thing that I've observed in a lot of my patients as well. And yeah, so friends also can definitely babysit at times,
Hmm.
give opportunity for the mother to take naps.
Yeah.
Husbands have to share the responsibility, right? Uh, but this is a very easier said than done. So I feel that educating them since the time they start understanding all these things
Yeah.
would be a long way to go. Like the age of puberty for men as well, it's a very difficult time for them, but they also start being mindful about their emotions as well.
Hmm.
So that age, I think education is very important, which is lacking. There's no chapter in our biology regarding maternal health, mental health of mothers. Maybe add it.
Hmm.
Why not? Yeah, it is an important stage of everyone's lives. So that is something that can be done by the government and various
Yeah.
agencies.
And also, many people, unfortunately, even today, they don't go to schools. And people who go to schools, as
Mm,
you said, don't have a special chapter on this subject.
right.
Let alone people who are not into the schools, and so they are actually brought up
Definitely.
very conventionally, very traditionally, that this is just a process and you got to be a part of it. It could, it's a one way to look at it, that you are, it's a process and you need to be accept, but it's also very important to see the other sides of it and be mindful of them. And I think that the other institutions besides the educational institutions, as there are very
Definitely.
various different places, religious, for example, institutions where most of the people in India tend to go. I think there's something, it's a responsibility of these institutions as well, to educate the people who are coming for spiritual discourses, to openly have a dialogue and conversation about these subjects, because it could be one of the best sources of educating the masses, who- especially those who are not going to the schools and formal educational institutions. Yeah, yeah. Um,
Definitely.
yeah. And we spoke about the help that the relatives and friends who could extend, but most of the women today are working,
Right.
and they have a 9 to 5 jobs, and some of them are even stretching for 12, 13 hours a day, and and then they have some added responsibilities of the household as well. um, what do you think can the corporates do? Now, here we are talking about the educated masses, right?
Right. Right.
But still, I see that there is a lack in the empathetic view uh, or approach towards the women who are working in the corporate. It's just seen by these people also as a process, and they are given some time off, a few months off work, and after which they are not paid and they are expected to be on the job, or they are going to lose their job. Or do you think that there could be some changes in the approaches of the corporates, how they function and how they uh, take up this issue of postpartum depression or mental health of women during this time?
Right. So one thing that comes to my mind is that COVID has been traumatic for a lot of
Yeah.
us, but it has also opened up various avenues. This
Hmm.
platform, as such,
Yeah.
has been very accepting all across the world. So different modes of work, like working from home,
Hmm.
giving that flexibility.
Hmm.
That, you can work from home when you need. So definitely, they give a period maternity leave for a few months, but that may not be enough. After that, also the child will have those needs. The child is still
Hmm.
small,
Yeah.
so a lot of times having that flexibility of work times as well as workplace
Hmm.
may help. Uh, so I think that the period of maternity leave may be enough. 6 months is a good enough period because the woman also many times wants to go back to her
Yeah.
routine. Yeah, so
Yeah.
she also wishes to start working again.
Hmm.
So flexibility of these work places may be a good idea. If it is not possible, if she has to turn up to work,
Yeah.
then definitely one concern that a lot of mothers have is about breastfeeding.
Yeah.
So they can have zones specially designated for breastfeeding, which are safe zones.
Hmm.
They have to keep it separate and very comfortable for the mother. That is one thing that all corporates can definitely do, because a lot of railway stations, airports, everywhere it is becoming a norm to have special places for breastfeeding, because a lot of mothers are not very comfortable to breastfeed in the open.
Yeah.
Or yeah, so that is one thing that they can definitely do. Also, the managers need to have a very open communication with the new mothers regarding their needs. What do they want? What do they expect from as a change from their workplace or managers? Because every mother is unique as well. Every person is unique, so they'll have different needs. So whatever can be fulfilled, maybe that are easier to fulfill. They can try that. One thing that they can also try is having a confidential space regarding some issues which they face in their daily lives. Sometimes the productivity or efficiency of the mother may not match the pre-partum levels. Right? When so
Okay.
because of various issues that she's facing,
Hmm.
and because of that, a lot of colleagues or the team, they may directly go to blame game, like you're not working
Yeah.
very efficiently, you're not working very effectively.
Hmm.
Used to do this very effectively, used to match your targets very well. You can't you are not matching those targets now. So having a very confidential safe space is one thing that can be tried. And a lot of corporates also a lot of corporate patients also come to me for consultation. But
Okay.
what happens is that there's one thing that I've observed is the prescription that I write, or the notes that I write for the patient, they have to show it to their boss for approval. So
Oh. Hmm.
that is one thing that I find very silly, because the confidentiality that I had with the patient, and I have to write my notes and the prescription that I've given. They have to make xeroxes of it and submit it to their boss. That level of confidentiality should be maintained. Is one thing that I personally feel that could be tried.
Yeah.
And sessions. So I have been doing a lot of workplace stress, mental health awareness sessions in various
Hmm.
companies, which I have been finding that those are not very common, and these are something new that a lot of companies want to try,
Hmm.
and want to a lot of HRs, they
Okay.
want their employees to attend these seminars, workplace stress management seminars or various mental health seminars. So a rise in that also may help, because a lot of people don't have the basic understanding of what mental health disorders are, or what postpartum depression, what postpartum blues, what everything is. They don't have the slightest idea about it. So, because I'll just give you an example. Yesterday, I went to uh, a company nearby and for a workplace and mental health,
Hmm.
awareness seminar. When I asked them that, what do you think? Who goes to a psychiatrist? So, 80% of them had the same answer, that if someone is going mad, they'll go to a psychiatrist.
Yeah.
Right?
Hmm.
So, that basic understanding needs to be instilled in their minds. So,
Hmm.
seminars like this may help as well.
Yeah. Um, so then when do a person, or when does a woman who has identified that she is facing the postpartum or undergoing postpartum depression, and the family members also have identified this, but when is that particular time when she can approach for a professional help?
See, being very optimistic about this answer, as soon as she finds any change in her normal behavior, when she finds that I'm not behaving myself, which is persisting for a
Hmm.
few extra days.
Hmm.
Sometimes being not in the mood or being sad is perfectly natural. Everyone
Hmm.
faces that, even me, even you. But if it persistence, and if the roles that that person needs to fulfill are
Hmm.
not getting fulfilled very effectively,
Hmm.
I think that is the right time to consult a psychiatrist. But a lot of times that doesn't happen. A lot of times during a very severe stage, they turn out turn up to the OPD, and it also becomes very difficult for me to give
Yeah.
effective treatment. And then what happens is that sometimes we need to give a bit higher doses than normal, and because of that, the stigma regarding psychiatric medications and therapy and various side effects comes into show, right?
Hmm.
Because the stage at which the patient is coming to me is a very severe stage, and I have to give results, because or else there will be very dire consequences regarding the future decisions that that person takes.
Hmm.
A lot of suicidal patients also turn up to the OPD postpartum.
Okay.
So uh, I optimistically, as soon as they see that change, you need to consult. Also, one thing that I would like to definitely say that the difference between urban and rural population group. What happens is
Okay.
that uh, in the rural areas, these changes are very, very carefully observed by the family members. And what they do is they don't Google their symptoms, or they don't
Yeah.
uh, they just go to some person who may have an idea about it,
Okay.
which most of the times is the head of the village or a sarpanch.
Hmm.
And I've seen that a lot of times these head of villages are definitely very helpful, and they wish to do good for the entire village. So
Hmm.
what they'll do is they'll directly bring that woman to a psychiatrist or a specialist
Okay.
directly, because they know they may have faced such an issue with some other member of the village.
Hmm.
So when they see the results, they'll want everyone to take that help much sooner.
Okay.
Um, in the urban population group, a lot of times they Google their symptoms. They think that it is not that severe, and they're not very mindful about those symptoms. And they try to
Yeah.
I'll just go out for a
Walk or
walk, or
something.
I'll go
Yeah.
something, and I'll be fine. They'll start meditating, but
Hmm.
that also doesn't work in very severe cases,
Hmm. Hmm.
right?
Hmm. Hmm.
So at that time, that delay, of the symptom onset and treatment is also very important.
Okay.
So,
So you mentioned about medications,
right,
right? Yeah. And I'll be very honest, I'm very apprehensive to take
right,
medications which are particularly related to, psychiatry, or which will alter the way probably my brain functions and excretes hormones. I'll be very apprehensive about this.
right,
So
right.
I would just want you to, elaborate a little onto this, that is it like, is my apprehension all right, or is it not? Or I would just want you to say something about this, so that even I think I know many people like me who would not want to take these medications, be it like a simple sleeping pill, or you don't know the composition, what it is about, and then you don't know for how long you would have to take these medications.
Right,
So I have a lot
right.
of these apprehensions in my mind. So what do you say about this?
See, most of the people have these apprehensions, and I would say that before starting any medication for a pregnant female or a breastfeeding female,
Hmm.
I would also be very apprehensive. I would
Okay.
also think 10 times before
Hmm.
starting any medication. But so we'll go back in time. So I think 30, 40 years back,
Hmm.
in psychiatry, we only had a handful of medications.
Hmm.
Right? The trends have changed. A lot of research is going on in this field. A lot of you know amazing molecules have been coming out, right?
Okay.
And we get a very proper training of the side effect profile on these
Hmm.
medications. And the only goal of the companies that are producing these molecules as of now are to reduce the side effects. Right?
Okay.
In the past, I may agree that there were some side effects which you know uh, may hamper a lot of things.
Yeah.
But currently, we have a lot of options. We have many of lot of things.
Hmm.
First, second thing is that sometimes that severity, there are two outcomes. If we don't give results, if we don't medicate and we don't mitigate the symptoms, there can be dire consequences like suicide or harm to the child as
Okay.
well. Now, what is deadlier? Tell me, having a bit of nausea or GI upset or suicide.
Hmm.
That is something that people don't understand that well.
Hmm.
That if you don't treat those symptoms as soon as possible, something uh, you know life threatening can happen
Yeah.
for the mother and the baby as well.
Hmm.
So we are left with no option at that
Okay.
rather than medical. So coming back to the question, so as soon as you see any change, as soon as your functioning starts getting affected, even social functioning, occupational functioning, personal functioning, that is the right time to go to a psychiatrist or any mental health professional. Because at that time, even without any medications, with therapy as well, we can definitely mitigate these symptoms.
Hmm.
But all this is biological. All this is brain related. A lot of processes in the brain are changed, because of which these changes in the mind body are, right?
Okay.
So definitely medications help a lot. We have a lot of cases where medications have prevented a lot of life-threatening things to have.
Hmm. Okay.
So yeah, that's something that
So it goes, like what I understood by this is that it goes step by step. First, you try to have a conversation, start with
right,
usual therapy, and if you
right.
feel that the person is in a
It's
more
all about the
serious,
severity,
all right,
mild, moderate, and severe. So a
all
lot of
right,
mild cases may be very very effective by
hmm,
therapy as well,
hmm,
right?
hmm, good,
Moderate and severe cases may need a combination of therapy as well as medication.
hmm. And
Also,
also,
yeah,
yeah, please continue. Yeah.
also there are other modes of treatment as well which we can try. So a lot of
Okay.
other treatments which we can discuss in some other
Yeah,
time.
yeah.
Yeah,
So actually, there are many people, who are, I think it's not a medical certification, but then there are different certifications at present available to become a therapist, to become a psychotherapist,
right,
hypnosis, and all of it. So, but these are not medically certified. So I think first, uh, I ask this question very often to my guests. So, what is the step? So, if somebody has identified that he or she has a problem, then should the person directly go to a psychiatrist, a clinic, get a clinical medical help, or it could be like a stepwise hierarchical approach where she can first go to a usual therapist who just has a certification, a counselor who can just listen to your problems and try to give you uh, some relaxation techniques, some means, and if it doesn't help, then he or she can uh, give you a recommendation to approach a psychiatrist. Like, what is the usual hierarchy of going through this process?
right. So as we are talking about certification, a lot of courses that are online, they can
Yeah.
even give you a certificate to become a counselor after a week of training,
Okay.
online training.
Okay.
After only a week, imagine. So you
Yeah.
know, uh, That is one thing that we have been observing a lot in our country, India, that a lot of these certifications may not be very genuine.
Hmm.
They definitely learn something, but
Hmm.
to practically, have an approach to patients, and because it is a very big responsibility to talk to patients, and whatever you are saying may have a huge impact on that person in front of
Hmm.
you, right? A lot of times, untrained or less trained, or these certificates, these very easily available certificates, people have a biased approach.
Hmm.
So whatever they'll say may have worked for them, or may have worked for someone else, which
Hmm.
they'll apply to everyone,
All right.
which then is ineffective to that person, or maybe may have an opposite reaction,
Hmm.
may have a worsening in that patient's thought process as
Yeah.
well. So, any mental health professional who has had a proper training,
Hmm.
okay? Here in India, a lot of trained psychologists have been given a certificate number, right,
All
which
right.
they have to show on their screen, on their board and
Okay.
such.
Hmm.
We as doctors, as psychiatrists, also get a registration number, right?
Hmm.
Which when they put that registration number in uh, module or a database of the medical registry, they can get our details, A
All
to
right.
Z, all details, where we have had training and what is our degree and is our
How
degree
much?
true or
Okay.
not, right?
Okay. Okay.
So I think, so coming back to the question, the experience that I have had here, because a lot of people are confused where to go, to a psychologist or to a psychiatrist. Um, Going to a psychiatrist would have its own advantages, right? And definitely the other way around as well. A psychiatrist can then tell, there are a lot of therapies. There's general counseling and talk therapy, a lot of specific therapies
Okay.
like CPT, DPT, a lot of thousands of therapies, which we are definitely trained about, right?
Hmm.
So we can definitely tell the psychologist
Okay.
that this person needs this therapy, right?
Hmm.
And this may be the diagnosis. And for psychodiagnostic approaches, various testings,
Hmm.
the psychologist can also pitch in that. So joint approach is always better.
All
So
right.
any center which has a psychiatrist and a psychologist both together in that same campus,
Hmm.
maybe a safer way to approach things.
Got it. Okay.
Yeah,
Okay. All right. And one question that was also coming to my mind while we were talking is that you said
yeah.
that if a person um, faces or observes any kind of changes in the mood, and especially that's like on the sadder side, right? Is like if a person is becoming very happy more than usual, can that also be considered depression?
So mood instability, right?
Okay.
The, if unusual happiness, a lot of
Mm-hmm.
excessive happiness, with uh, you know irritability also going hand in hand, getting very irritable and very very um, ecstatic about a lot of things,
Okay.
that may be a sign of mania as well. So
Oh,
that is
okay.
bipolarity, which is also mood disorder, where there are different phases of bipolar depression as well as mania.
All right.
Hypomania also may be a part of bipolarity as well. So diagnosing that is gets very difficult at times, because if a person is very happy, no one will take them to a psychiatrist. They'll just think that it is just a phase, but it may get very worse very very quickly.
Okay.
So catching those symptoms very
Hmm.
early.
Hmm.
Right?
Okay. Okay. And in your experience, how common is this problem of postpartum depression in our society?
Um, so patients do come to the OPD with postpartum depression, but because of the lack of knowledge about
Hmm.
postpartum depression, uh, why do they turn up to the OPD? The symptoms are mainly I can't sleep properly.
Okay.
They'll just say that I can't sleep properly.
Hmm.
They'll just say that even if I wish to sleep, I can't sleep.
Hmm.
And the husband will say ki they're not taking care of the baby properly. That's it. I don't know why, but they don't uh, uh, go near the baby, or they just hand over the baby to someone else. So there's something abnormal that I've seen. So we have come to,
Okay.
because they have no idea about what postpartum depression is, what hormonal changes have taken place in the woman's body. So, keeping an open ear, looking for catching these symptoms. Even if a person has just come with disturbed sleep, the only
Hmm.
complaint is disturbed sleep, they
Hmm.
won't be able to share. So, creating a very comfortable space. We are very trained in,
Yeah.
the more patients we see, we become more trained in the art of, taking out history. We have to extract history from the patient. A
Hmm.
lot of times, patient will just say, "Arey, sir, I'm just not able to sleep properly."
Hmm.
That's it, nothing else.
Yeah.
But giving more time, being more mindful about the symptoms, we can definitely make a diagnosis of postpartum depression. So, as I said, a lot of times the patient doesn't just come with the symptoms of depression. We
Hmm.
have to extract the symptoms from the
Okay.
gene. Yeah, but I think I see 2 3 cases of postpartum depression, uh, every month, but
Okay.
it is much much more common in reality, much more common, and a lot of times, uh, definitely after 6 or 7 months, it settles by itself. Sometimes when it becomes very very severe, right, then they have to definitely come to a psychiatrist and take help. A lot of times people don't understand the difference between postpartum blues and postpartum depression, which we may discuss in this regard to this question. Postpartum blues is like, definitely the pregnancy and giving birth is a major life event, huge event, because no one has prepared you for that. There is a major change in you know uh, the environment. There is someone else to take care of. There's someone else you have to think about before yourself.
Hmm.
So, because of this major change, also, people are not able to adjust to this change.
Hmm.
Many mothers, new mothers. So, definitely, they in postpartum blues, there are symptoms of sadness of mood. They don't feel, they're a bit irritable,
Hmm.
but all these symptoms are not very very severe,
Okay.
and they're not very pervasive. They'll be happy after 3 days. They'll be cheerful. They'll be playful, but 3 4 days they'll be very sad. Again, they'll
Okay.
be cheerful, or So at that time, they don't need treatment as such, or psychotherapy as well. They need uh, just some additional support
Okay.
to mitigate these symptoms. Also, there's something unique which you may also may be very surprised to hear. Postpartum depression also happens in males. Can you imagine?
Okay.
So 8 to 10% of new fathers also go through postpartum depression, because it is also a major change for them.
Hmm.
Right. So
All right.
symptoms of depression which occur in new fathers, which sustain for 2 weeks, they can also be diagnosed as depression, postpartum depression. Yeah,
Okay.
and it is not because of the hormonal changes,
Yeah.
but it is more of the lack of proper sleep, uh,
Hmm.
genetic predisposition to uh, you know get depression in this lifetime.
Hmm.
So that may be a triggering event for the
Okay.
depression,
All right.
and that is also something which is a taboo. Males' mental health is also an issue that you know is a taboo in the society. Just shrug it off. Just shake it off.
Yeah.
How can you be depressed? Yeah,
Hmm.
because a lot of companies, also corporates, don't have uh, they have maternal leave but not a paternal leave. So that is also one thing that they can consider
Yeah. Yeah.
to give additional help to the mothers as well, and for themselves as well, to adjust
Yeah.
to this new change.
Yeah. The period of paternity leave is, I think, just 1 week or 2 weeks maximum, and that's
Exactly,
probably
exactly,
not enough because the father also wants to stay
definitely.
back at home, and I yeah, it's understood. Yeah. Uh,
Mm.
I think I've asked you most of the questions I had. I think every question that I had, I have put across. Is there anything else that you would want to add to this conversation?
The series that you have, undertaken is definitely is going to help a lot of individuals, and uh, we have known each other since a long time. Your sister
Yeah.
is my sister is your friend, so it's very lovely to see, you take on this responsibility of uh, social awareness.
Yeah.
Mm. It's a very good thing, and I wish you a lot of success. And
Thank you, Akash, and I
yes,
wish you the same. And you're doing a great job. And I hope we can catch up one more time uh, to have a detailed conversation around this subject, because it's really interesting and fascinating to learn about these things, especially when you talk to professionals. You get a clear idea of, it's very different from googling the symptoms or
right,
learning things
right,
from
right.
Google. So I wish you the best, and I hope to stay in touch with you and discuss more about this
Okay,
subject. Yeah. Thank you so much,
thank you for the
Akash.
opportunity.
Yeah.
It was
Thanks.
lovely
Yeah.
to talk to you.
Same here.
Bye.
Bye.